A man walks into a hospital. He feels completely fine. No chest pain, no cough, no fever. He just came in for a routine checkup. But somewhere in a dark room down the corridor, a radiologist is staring at his x-ray. And he has gone very, very quiet. The patient doesn't know this yet. He's in the waiting room, reading a magazine, maybe thinking about lunch. He has no idea that someone just found something inside his chest that wasn't supposed to be there. So who is this person in the dark room? Why does this doctor never meet patients? How can someone know this much about your body without ever touching you? And how often is this happening right now in hospitals all over the world? Today, we find out. Most people think doctors are the ones who examine you. Surgeons cut, cardiologists listen to your heart. But radiologists, they do something almost no other doctor does. They read your body like a document. Every shadow, every white patch, every small asymmetry, it all means something. And they have trained for years to decode exactly what. Here's what most people don't know. In a large hospital, a radiologist might read over 100 scans in a single day. That means in the time it took you to watch this video so far, a radiologist somewhere has already looked inside the bodies of dozens of people, found what's wrong, and sent that information to a doctor you'll never know existed. So how does a radiologist actually think? Imagine you were handed a photograph of a city taken from a satellite. No labels, no street names. You have been trained to identify every building, every road pattern, every shadow. You know that a dark patch over there means a park. A bright cluster means a commercial district. That's radiology. Your body is the city. The scan is the satellite image. But here's where it gets interesting. A good radiologist doesn't just find what's there. They find what's missing. A shadow that should be symmetric but isn't. A bone that healed in a way that tells a story. Sometimes, and this is the part that keeps radiologists awake, they find something that wasn't caught for years. Something that was there all along, hiding in plain sight. Let me give you a real example, keeping all patient details out of this. A young woman, mid-30s, comes in for what everyone thinks is a routine chest infection. She's been coughing for 3 weeks, given antibiotics twice. Nothing worked. The referring doctor orders a chest x-ray just to rule things out. When the radiologist opens that image, everything changes. The x-ray shows a mass. Not large, not dramatic. Easy to miss if you weren't trained to look. The radiologist writes his report, flags it urgent. Within an hour, that woman's entire treatment pathway has changed. Not because of a symptom, not because she felt any pain. Because of a shadow on a piece of film that a trained eye recognized for exactly what it was. Here's the science of what that radiologist actually saw. In a chest x-ray, air appears black, bone appears white. Soft tissue sits in between as shades of gray. A mass, abnormal tissue, appears as a white or gray opacity where there should only be black. Your lungs should look like dark, open spaces. When something fills that space that shouldn't be there, it glows. And a radiologist is trained to see exactly that glow. And now for the fact I genuinely cannot stop thinking about. The average radiologist makes clinical decisions in under 4 seconds per image. 4 seconds. That's less time than it takes most people to choose a Netflix show. And yet in those 4 seconds, they are determining whether your life is about to change. No pressure. Just someone's entire future in 4 seconds while drinking coffee. Every scan you have ever had, someone read it. Someone you will probably never meet, never thank, never know the name of. And in some cases, that someone is the reason you are still here. That's not dramatic. That's just how radiology actually works. But here's the question nobody asks. If a radiologist can find a mass in your lung before you feel a single symptom, what else are they finding? And why isn't anyone talking about it? That's the next video. Subscribe so you don't miss it.